What is asthma? An asthma flare or asthma attack happens when there is a constriction of the small airways in the lungs along with the narrowing of the airway due to buildup of mucus and swollen tissue. Air is not able to move through these constricted passageways with ease, and your child may feel shortness of breath, chest pain, or chest pressure. They may cough or wheeze as their body is trying to force the air through the constricted air passages. Without treatment, the breathing and coughing typically worsen, and your child may require emergency care. What are some common triggers for asthma? For many children, cold or flu symptoms may trigger an asthma attack. That is why we tend to see more children with symptoms during the winter months. Physical activity may also be a trigger for some children. However, there can be other environmental triggers such as secondhand cigarette smoke, pollen or dust, pet dander, plants, or strong scents like perfumes, essential oils, or incense. Secondhand smoke can be especially irritating to your child's lungs because it seeps into clothing, bedding, furniture fabric, carpets, and even skin and hair. This makes it hard for them to get away from the trigger even if the actual smoking is done outdoors or in another room. For this reason, we recommend avoiding secondhand smoke exposure for your child, especially if they have asthma. Next, we will give a brief overview of asthma medications which your child may be prescribed.
I'm going to review the two most common types of asthma medications. The first one is called albuterol. It also goes by the name ProAir, Ventolin, or Proventil. Albuterol is what we call a rescue medication, meaning it should be given immediately at the first sign of any asthma symptoms so that your child can breathe more easily as soon as possible. It usually starts to work in about 5 to 8 minutes and lasts for about 3 to 6 hours. Albuterol works by relaxing the airway muscles that tighten and swell when an asthma flare-up is happening. Now, when asthma symptoms are occurring too often, for example, if albuterol is needed more than twice a week, then a controller medication is prescribed next. The most common ones are Alvesco, Flovent, budesonide, or Qvar. They work to make breathing easier by reducing inflammation and swelling of the airways. When these medications are taken every day, they can help prevent asthma attacks and decrease persistent coughing, wheezing, or shortness of breath. So why is this important? Well, when asthma is not well controlled over a long period of time, it can cause long-term permanent damage to your child's lungs. Albuterol and the controller medications are usually prescribed as an inhaler. This enables your child to breathe the medication directly into their lungs as a liquid mist. By taking the medication this way, it works much faster than by swallowing the medication in the form of a pill or a liquid. Your child's provider will also likely order a spacer or chamber to be used with the inhaler. For children under 8, the spacer will come with a mask. For children 8 and up, there will be a mouthpiece at the end. Who should use spacers? Well, everyone. Without a spacer, the liquid mist comes out of the inhaler too fast, and it just coats the inside of the mouth and throat. The spacer, however, will slow things down so your child can breathe in the medication properly, getting it into their lungs where it is needed. Now, make sure that your medical provider, nurse, or pharmacist reviews with you the proper way to use the inhaler with the spacer and how to clean them, which should be done at least once a week. This is extremely important. If you don't use them the right way and don't care for them properly, then they won't work well to treat your child's asthma symptoms. Now that we've reviewed the basics of asthma and medications used, what happens next? Your child may either follow up with a pediatric asthma nurse or their regular provider to check in periodically and ensure their asthma is well controlled. Please keep your child's doctor informed of any significant changes in their asthma symptoms or exposures. Please refer to the link below for additional information on asthma in children. In closing, you can stay in close contact with your child's provider through kp.org and the My Doctor Online app. Be sure to go to all scheduled appointments and make sure your child gets the flu shot every year.